This would indicate that the discs at the base of the spine, most important question that pops up occasionally is when is ruptured an emergency? And the disc matter, which that is a very good question, and there are times when it might be oozed into the spinal canal and that would be a case where the symptoms are really severe. And the coping with without medical intervention is beyond you. So this is the super important classical definition of a medical emergency is loss of bowel or bladder control. The reason that you have lost bowel or bladder control would be most likely a severe damage to a lumbar disc, so much so that the disc wall is torn and the contents of the disc, the jelly, viscous disc material, the inner material, is actually oozed out of the hole in the wall of the disc and actually now is sitting inside the spinal canal where it never should be and is pressing on nerves that control the muscles of the bowel and the bladder. So they're either stimulating it to empty or they're actually, you've just lost the ability to keep the bowel closed or the bladder from emptying. So this is a really bad indicator and it suggests that there's severe damage that must be addressed immediately. It's not the sort of thing where you go to bed and hope it'll get better in a week on its own. So there are instances where you could have a severe bulge in the disc wall, like driving the car up onto the footpath and the tyre wall, because more load is on that wheel than the others, the tyre wall will look like the tyre's going flat. So you get the same impact, some effect in the back. If one of the discs is overloaded, it will bulge, and that bulge can go into the spinal canal and press on nerves, causing similar effects. But that complete loss of bowel and bladder that is sort of not resolving, that is quite often a sign of that sort of severe damage, and that is often only, for the majority of people, addressed via an operation. There are rare cases where very determined individuals have actually taken a non-operational, non-surgical approach and have done twice-a-day visits for 2 to 3 weeks, and that has often been sufficient to actually unload the area and let the body go in and begin to reabsorb that disc material in the spinal canal in the same way that the body will go and consume or break down any injury tissue. So whether it's injury of bone tissue or injury of muscle, ligament, tendon, the macrophages go in and they actually do a mop-up or rubbish operation. So that is, the red flag is a loss of bowel or bladder. And it's not just a one event, but it's actually protracted. Usually it's accompanied by severe pain, that 10 out of 10 pain that no painkiller seems to appropriately manage. So it's a serious situation, and you're best to see if you can get an ambulance ride and go to hospital, because sitting up in a car could make it worse, if that seemed barely possible. Now, so the surgery is the most likely intervention. In some instances, some medical experts would look at a cortisone injection, which would be guided through X-ray or /CT, and that would give them the opportunity to put an anti-inflammatory directly into the area and use that as a help to reduce load on the damaged tissue. Now, in the case that it's not that severe, you can often work with it over a few weeks. You should see a significant improvement. You may well take painkillers and anti-inflammatories, whether they're pharmaceutical or natural sourced is up to the individual. The question that we would ask usually is, we want to know the history. So was it a traumatic event? Did you catch something very heavy? Did you fall downstairs? Did you sit on your bottom when you missed the chair? So what direct force in the area caused this damage? Was it an acute severe injury, or was it something progressive, sort of the death of 1,000 lashes, that nothing particular happened, but it progressively got worse and then tipped over a balance point where it became severe? So in that case, we're wanting to work out what was setting the body up for this sort of injury, because it's usually driven by a loss of competence in the ligaments that retain strength and balance and symmetry in the pelvis and back, causing overload of the discs. So even if you had a surgical intervention, it would be quite prudent to have that checked and resolve what drove the injury in the first place. Because if you don't do that, you are open to some sort of re-injury, maybe on another level. Plus, you may be left with pain, because the pain was not only coming from that disc injury, but often from a multiple of other areas in the back and pelvis that are also overloaded and injured, but less severely and less likely to cause that sort of extreme symptomatic picture, pain pattern and functional pattern. So, there is often a multi-layered approach to get this completely right, so it's less likely to come back and you're actually comfortable again and you're moving and feeling more like a person who had no injury at all. The paradox is that quite often, once this injury is medically treated, if that was appropriate, and then we do chiropractic work to actually balance the structure and put symmetry and strength back into the system, and then add exercise and rehab, that person actually is significantly better than they were prior to the injury. And that's a really positive outcome. So although it's a terrible event, if you can actually pop out the other side 6 months later feeling 10 or 15 years younger, and actually much less likely to have a re-injury, and feeling good enough to move every day and get back into a full active life, then that's actually probably the best of all worlds. So endeavour to stay fully healthy. I'm going to put a link in here to several exercises you could do on a daily basis that will actually optimize things. And if your back is sore, these are very safe approaches that you could use to actually help to decompress and unload the back so that you can begin to feel better sooner. All the best.